Happy Nurses Week. You all do such a great job at caring for everybody else, but I'm not so sure, as you're going to see with hot off the press findings from a national nurses study, we often don't do a great job of self-care. And that is super, super important. So I'm delighted to be here today to pump all of you up, to say you are very important. But we've got to help people make behavior change for better self-care. How many of you have tried to change the behavior of somebody you love? We all have, right? Whether it's squeeze the toothpaste differently, put the toilet seat down, get more physically active. But what do we know about behavior change? Is it easy? No, most people don't change behavior unless crisis happens or their emotions are raised. So I want to raise your emotion just a little bit by sharing my personal story. So how many of you know where Republic, Pennsylvania is? Anybody know? And anybody from Pittsburgh here? Okay, great. Republic's about 1 hour southwest of Pittsburgh, near the West Virginia border. So I grew up in that small little town that's actually all boarded up now. It's really sad to go back there. My dad was a coal miner. My mom was a part-time cook. We were labeled working poor, but I was a happy kid. I was born with rose-colored glasses on, and to this day, I can make lemonade out of lemons. And that resiliency really came in handy when at 15 years of age, I was home alone with my mom. She sat down on our couch to pay bills. I started heading up the stairs to get my things to take a shower. She sneezed. I said, "Bless you, Mom." She didn't answer me. I said, "Bless you, Mom." She didn't answer me. I thought, that's odd. So I walked down the stairs, and my mom's head was already back on the couch. She was unconscious. I shook her. Mom, what's wrong?" She fell over and she died right in front of me. Now, how many of you have children? Can you imagine how devastating and traumatic it would be to have you die traumatically and suddenly right in front of one of your children? You can imagine I suffered with terrible post-traumatic stress disorder for a couple of years. I didn't even know what that was back in the 70s. All I knew, I'd wake up during the night with terrible nightmares, cold sweats. I wasn't eating. I wasn't functioning well in school. And after a few months of that, I was taken to my family physician by a family member who said, "Do something to help Bern." And guess what he did, as so many providers do today? Got out his prescription pad, wrote a script for Valium, said, "Give Bern one of these every night. She'll sleep and be just fine." Never any counseling. Never the gold standard evidence-based treatment for anxiety and depression, which is cognitive behavior therapy. And sadly today, 1 out of 4 children and teens have a mental health problem, yet less than 25% get any treatment. And if they do get treatment, it's usually not evidence-based, gold standard cognitive behavior therapy. Now, what's really sad about my mom's story, my mom had a history of headaches for over a year. And my dad kept saying, would you please go to the doctor, figure out what's wrong. She went to her family physician 1 week before she died. Guess what her diagnosis was? High blood pressure. She was given a prescription for a blood pressure medication that my dad found in her purse after she died. She never took it. Now, who knows for sure if she would have taken it that morning, if indeed she wouldn't have stroked out when she had sneezed. But all I knew was I was 15. I didn't have a mom anymore. But what doesn't break us only makes us stronger. And because of what I went through as an adolescent, I became really passionate about becoming a nurse, then a pediatric nurse practitioner, then a psychiatric mental health NP, so that I could devote my career to developing and testing CBT-based interventions to help kids and teens and college students who weren't getting evidence-based treatment. And I'm so excited to share. So many times researchers devote their entire career to grant writing, doing the research, publishing it, and then so little of it ever hits the real world to improve outcomes. But this CBT program that I developed is now being used in 40 states across the country, and providers are getting reimbursed for it. After 2.5 years of working with our attorneys here at the university, I have finally been given permission to gift my CBT program to the university so we can start using it more with our students. Also, we have adapted this Mind Strong program for new nurse residents. And we just tested it. Marlene Sampson, who a lot of you know, she's my PhD student, and for her PhD dissertation, I'm so excited. She's going to be doing a randomized controlled pilot study to test this program with new nurse residents this summer. So how to get to Ohio State from Republic, Pennsylvania? 6 years ago, I left sunny Arizona to come to Columbus, Ohio. And a lot of people say to me, why in the Sam Hill would you have left sunny Arizona to come here? Well, it was for a big pioneering dream. And I want you guys to hear this, because so often nurses don't dream big enough, and we don't risk take. And we've got to do more of that. So I was dean at Arizona State University College of Nursing and Health Innovation when Ohio State started calling me. We've seen how you've expanded the college in Sun Devil country. We want you to come here and do the same thing at Ohio State. And I said, I'm humbled you thought of me, but I have no intentions of making a lateral move. But here's where the dream comes in. I had been studying corporate wellness for a few years, and I was astounded that corporations all throughout the country were hiring physicians as chief wellness officers because they knew if we have a healthy and well population, they will be more fully engaged, productive. They won't miss as much work. So it's an investment. So I thought in my next dream, if I could go to a big university and be chief wellness officer, where I could be spearheading population health and wellness, I would love to do something like that. So I said to Carol Whitaker, if there were an opportunity to combine the dean's job with a university-wide leadership position as chief wellness officer, I might consider it. So Gordon Gee calls me next, and Gordon says, Bern, I heard what you said to Carol Whitaker, and the timing of what you said is uncanny. Because I was just looking at our faculty and staff healthcare claim data, and it's moving in the wrong direction. So come and talk to us about what you might do differently with what we're doing as a chief wellness officer. So you know the end of the story. Here I am in this very pioneering position. But I want to tell you what's happened since my appointment here. Other universities, because no other university had a chief wellness officer, and other universities are now appointing them all across the country. And they're looking to our university because of the great outcomes we're getting with health and well-being. And I'll show you some of those later. So I didn't bring you here to depress you today, but we got to look at where we're currently at. Think about this. 1 out of 2 people have a chronic disease. But what's really astounding about that fact is 80% of chronic disease is totally preventable. Totally. We could almost wipe out chronic disease if we could just get people to change their behaviors. Walk more, sit less, eat a little bit healthier. This is the first time in our history where our children are predicted to have a shorter lifespan than their parents. So the opportunity is great for improvement. How many of you remember these news headlines back in 2012? I'll never forget where I was at when this flashed across my screen. And I'm like, no, this can't be. Nursing should be the role model of healthy lifestyle behaviors. How can this possibly be? We have poorer health than physicians. As you will see, we had almost 3 times the smoking rate as physicians in this study. We ate less healthy. We had higher rates of obesity, high blood pressure, diabetes, and depression. Now, I really want you to note, depression in this study was 14%. And that's important because I'm going to share the findings from our current National Nurses Health Study. So I chair at the American Academy of Nursing a group that is focused on Million Hearts. You all are familiar with the CDC's Million Hearts initiative to prevent 1 million heart attacks and strokes. Well, I pulled this group together and said, let's do a current nurses' health study. Let's see if we've gotten better, not worse, than the 2012 study. As you can see here, the number one physical problem reported by these nurses, we sampled 3,800 nurses from across the United States. This data is only on the practicing nurses. So that's why the N is less. So you can see high cholesterol, high blood pressure affected about 25% of this sample, but look at depression. 23% of these nurses reported depression. 23%. So overall, more than half of the nurses in this sample had poor mental or physical health. We also looked at if the nurses thought they worked in a place that supported wellness, did they have better health outcomes? And this shows you they did. If they felt less stress in their work environment, they also had better health outcomes. But look at this next slide. This is the first study that shows depression was the leading predictor of medical errors in this sample. Depression. And nurses in poor mental or physical health had a 26 to 71% greater chance of making a medical error. This is really important because medical errors are the third leading cause of death in America right now. More than 400,000 people lose their lives every single year from preventable medical errors. So I am writing an urgent call to action right now with 3 other physicians that are part of the National Academy of Medicine's Action Collaborative on Clinician Well-Being. In this paper, we are targeting to the C-suite to say every university, every healthcare system should have a chief wellness officer to pay attention to clinician well-being. Well, we got a lot of national PR from this particular study. I did a webinar this week for the American Hospital Association. I have been really ramping up talking to entities like JCAHO about this issue. And our study supported other studies For a long time now, we have research evidence to show the longer the shift work, the poorer the health outcomes and the more medical errors that are made. We must stop 12-hour shifts. We must. But why do CEOs not want to stop them? Because nurses say they love them. But the evidence shows the next day or two, after coming off a 3-day, 12-hour stint, people are totally fried. So again, we've got to stop doing what we know is harmful for our nurses and for our patients. So then let's look at this sample's healthy lifestyle behaviors. Only 17% of these nurses said, I am eating the recommended 5 fruits and vegetables a day. 52% of these nurses were getting the recommended 7 hours of sleep per night. Only 32% of these nurses who were in the targeted age group were taking a baby aspirin a day, as recommended by the United States Preventive Services Task Force. Only 27% were getting the recommended 150 minutes of physical activity in a week. 6.6% of these nurses were using e-cigarettes. Only 3% reported being current smokers, but 21% reported being past smokers, higher than the general population. Then, what is concerning about the alcohol use slide? 12% of these nurses said, when I drink a minimum of 3 to 4 alcoholic beverages at a time. So we looked further at what were the biggest predictors of physical activity, 7 hours of sleep, healthy eating. And as you will see on this slide, nurses who had higher levels of education, master's degree and higher, engaged more in physical activity. Those who were in a relationship engaged more in physical activity. Nurses who worked longer shifts had less physical activity. See, everybody thinks, oh, nurses run around so much taking care of their patients, they get their 10,000 steps in a day. But it's the opposite, because we've become very technology focused, so more stationary. So we don't get in the recommended amounts of physical activity. This set of demographics pretty much so predicted the behaviors across the multiple behaviors. And the other thing I want to point out here, nurses in administrative roles were sleeping the least. They were not meeting the recommended 7 hours of physical activity a week. So if you're not aware, last spring, the National Academy of Medicine said, clinician depression, burnout, and compassion fatigue is reaching epidemic levels, and we've got to do something about this. So last spring, the National Academy of Medicine launched an action collaborative on clinician well-being. And I'm so blessed because I'm one of the few nurses on that action collaborative, and I'm representing Ohio State on that. So there's about 50 of us from across the country working our tails off to raise visibility, to develop this fantastic knowledge hub that you can access. At this website, we have multiple resources, tools for both clinicians and healthcare administrators to say, this is what's working. Now we have to translate that more quickly into practice. And I accepted an invitation from American Nurse Today to write 9 columns focused on giving nurses evidence-based tips around the 9 pillars of well-being. And this is the last one that we wrote. So every issue, if you belong to the ANA, you'll see one of these wellness-focused columns. So if you ask me today, what's the number one cause of death and disease in the United States? I'm going to tell you, it's behaviors. Cardiovascular disease is technically the number one cause of death. Do you guys know 1 out of 31 women die of breast cancer, but 1 out of 3 die of heart disease? But what gets the biggest bang? It's usually breast cancer. So we've got to do more to raise women's, in particular, awareness about heart disease and the symptoms that are typically much different than how men present. That last picture, I'm very serious about that one. Beware of the chair. How many of you sit on average 3 hours a day? Most of this room. So, population health studies show if we sit 3 hours a day, that increases our cardiac risk by 30%. If we sit 5 a day, that's comparable to smoking 1.25 packs of cigarettes on our bodies every single day. Now, are you shocked by that evidence? If you are, how come everybody didn't stand up? But think about that. Think about that a second. Why doesn't everybody start standing when I share that evidence? It's because of culture. People feel uncomfortable to stand in meetings when everybody else is sitting. But we have to change that culture. I'm so excited to tell you, at our monthly dean's meetings, probably half to 2/3 of us stand. Next time you go to have a meeting, say to your colleagues, let's have a standing meeting today instead of a sitting meeting. In addition to being good for your cardiac health, you get through meetings a heck of a lot faster when you stand versus when you sit. So I want you to think about right now your own healthy lifestyle behaviors, your physical activity, your sleep, your stress management. if you keep doing what you're doing today, what is the last 10 years of your life going to look like?
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
That's a very powerful clip, isn't it? So we make behavior choices every day. I didn't fabricate that slide. This is a real fitness facility in the state of California, and you have a choice. I can either walk the stairs or I can take the escalator to work out for the day. So a group of psychologists studied how many people on average a day during the course of this 1 week would take the steps instead of the escalator. You know what they found? 2 people a day took the steps. So I want you to think about, how often do you drive around a parking lot looking for the closest place to park, instead of saying, I'm going to park further away so that I get my 10,000 steps in a day? So I told you my mom died hemorrhagic stroke when I was 15. My dad had his heart attack when I was 19. So I could say, I've got horrible cardiac genes. I'm going to die young. So I might as well eat what I want to eat, not worry about activity, because it's not going to matter. This is a population health study, though, of 1 million people that showed more than our genes, more than our social circumstances, more than the health care we receive. It's our behaviors that are going to determine whether we die young or not. But then look at the level of stress and depression that's rampant in our society today. Look at our students. We just had 2 students jump off the parking garage. We have an epidemic of mental health disorders. The World Health Organization has said by 2020, depression will be the second most impairing disease worldwide. We can't wait until people are depressed or have anxiety disorder to do something about it. We must be more proactive in giving our children, our teens, our college students coping and cognitive behavioral skills to deal with life, which is stressful in today's world. We must teach people how they think directly relates to how they feel and how they behave. This is a central concept in my CBT program. We teach people to change thought patterns so that they feel better and they engage in healthy behaviors. So if I had to give you an evidence-based recipe based on research of what you can do to really decrease your risk of all these chronic diseases, I would tell you, just focus on this. This is it. 30 minutes of physical activity 5 days a week. You might say, I don't have time. I got to get my kids off to school in the mornings. I'm packing their lunches. Then I come to work. I'm exhausted by the time I get home. Nurses, help each other. Support each other to take 5-minute breaks throughout your day. Get together, put on a fun dance, move, do 3 minutes of jumping jacks together, but just get moving. Exercise is medicine. It's better than medicine because it has no side effects. I should say it has no negative side effects, right? So move more. Move more. Sit less. When you feel that mid-morning or mid-afternoon slump and you've been sitting a while, instead of reaching for caffeine, get up, jump around, do some jumping, just get moving. You will feel so much better. Sitting is the biggest zapper of our energy. It really is. Try moving more. 5 fruits and vegetables a day. Don't smoke. Limit alcohol. If you drink, research shows, the CDC recommends 1 drink a day if you're a woman, 2 a day if you're a man. And everybody asks me, how big can that drink be? And I always tell everybody, a single serving, 5 ounces of wine, 1.5 ounces of alcohol or beer, not the size of the humongous drinks in Las Vegas. So in 2016, the CDC came out with a study, and they said, very sadly, do you know only 6% of the population meets these? 6%. And by the way, if we could get everybody to meeting these, we can reduce healthcare costs by 83%. But think about it. We still live in a sick care healthcare system. And it needs to move to well care, no matter where you're at on the wellness illness continuum. So every New Year's, about 90% of the population says, I'm going to set a health goal, whether it's to exercise more, eat healthier, and then by the end of the month, the majority of people fall off the wagon. I'm encouraging you, make today your January 1. Before you leave this auditorium, write down your commitment to just getting a little bit better at one of those healthy lifestyle behaviors, and then give it 30 days of consistent effort, because it takes 30 days to make or break a new habit. And this coming January 1, we are planning for a university-wide initiative called Make It or Break It in 30 days. So it's going to be a new challenge. So the biggest excuse for not exercising typically is time. But we all have the same amount of time. It's how we prioritize it. What are we told when we get on a plane and it decompresses and the O2 masks drop? Put them on yourself first, right? before you put them on children or older adults around you. And I want you to remember that. You are so important. But you've got to take care of yourself first, or you won't be able to take great care of your patients or your families.
These are roughly 28,835 jelly beans. I counted out 500 of them and used those to weigh the rest. In this pile, there's one jelly bean for each day that the average American will live. You might have more beans in your life, or maybe less, but on average, this is the time we have. Here's a single bean. It's your very first day. A special day, but kind of a rough day on everyone involved. Add 364 more and you have the first year of your life. Now, for a sense of scale, here are your first 15 years, 5,475 days. Which brings us to the threshold of adulthood, and at that moment, this is the time that we have left. And this is, on average, what we will do with all that time. We will be asleep for a total of 8,477 days. If we're lucky, some of that time we'll be sleeping next to someone we love. We will be in the process of eating, drinking, or preparing food for 1,635 days. We'll be at work, hopefully doing something satisfying, for the equivalent of 3,202 of those days. 1,099 days will be spent commuting or traveling from one place to another, maybe a little bit more if you live in LA. On average, we will watch television in one form or another for a total of 2,676 days. Household activities, like chores and tending to our pets and shopping, will take another 1,576 days. And we will care for the needs and well-being of others, our friends and family, for 564 days. We'll spend 671 days bathing, grooming, and doing all other bathroom-related activities, and another 720 days will go to community activities, like religious and civic duties, charities, and taking classes. After we remove all those beans, this is what remains. This is the time that we have left. Time for laughing, swimming, making art, going on hikes, text messages, reading, checking Facebook, playing softball, maybe even teaching yourself how to play the guitar. So what are you going to do with this time? How much of it do you think you've already used up? If you only had half of it, what would you do differently? What about half of that? How much time have you already spent worrying instead of doing something that you love? What if you just had one more day? What are you going to do today?
So, when I came to the university, we were doing a lot of good things in pockets. You know, we had our health plan with health coaches. We had your plan for health that was our web portal. We had student life doing good things there, but everything wasn't aligned. And it was really critical that we became one team with one vision. We looked at what works best in really cultivating a really strong wellness program. And when we looked at all the evidence on the topic, these were what mattered the most. It was really important to create a culture of well-being where healthy behaviors are the default choice. Not unhealthy behaviors, but healthy behaviors. Targeting our leaders and managers. Because if they aren't role modeling and walking the talk, the people underneath them aren't going to do the same. And then we created a wellness innovator program with faculty and staff. We have 500 wellness innovators, including a lot of nurses who work with our Buckeye Wellness team in creating cultures of well-being across the university. I would love half of you to see me after and say, Bern, I want to be one of those wellness innovators and work with you and our team, because we need more of you out there. So we have worked very hard on implementing what we know works best from research. And why does Ohio State invest about $5.5 million a year in wellness? Firstly, because we care about our Buckeye family. But if I'm talking to our chief financial officer, I got to talk about return on investment. And study after study shows every dollar that an organization invests in wellness, $3 to $4 come back. It decreases absenteeism, presenteeism. And also remember, 30 to 60% of new grads leave their first positions in the first year. And a lot of that is due to stress. And we don't prepare them well for how to handle that. So we have a vision here at Ohio State, and we're serious about it. We want to be the healthiest university in the world. And this is a healthier version of the 2-ton chocolate elephant and eating one bite at a time. So I created, along with Larry Llewellyn, who used to be here, a one university health and wellness council that is comprised of leaders from all of those entities. And we sit together every single month. We plan, we implement, and we're constantly evaluating. We adopted the socio-ecological model to guide what we do. We focus evidence-based interventions on individuals, on the family and social network, on the workplace culture, and then form policies around health and well-being. We're evidence-based. That's our philosophy. In God we trust, but everybody else better bring data to the table. And we work 24/7 on culture, because culture eats strategy for breakfast, lunch, and dinner. We have got to make it easy and fun for our folks to engage in wellness activities. So we have a menu of options for people. Not everybody's going to like going on the web or their iPhone to Your Plan for Health and doing online challenges. So we have other things available, rolling all the time. So we have this beautiful plate of how we can support you to be a little bit healthier. And as I mentioned, if you become a Buckeye Wellness Innovator, you get to go through a fabulous course called Health Athlete here. It's an energy management course. Wouldn't you like to have more energy throughout your day? In that course, we teach you how exactly to do that. We piloted that course with 61 new nurses, and we got some great results. What I'd love to do is offer that to all nurses in our healthcare system, so you can get tips on how to manage your energy better, how to eat healthier, how to engage in physical activity more often. And you will learn not to multitask. How many of you consider yourself great multitaskers? I did too. I could do 5 things at the same time and get really excited about that until I went to this course and became a trainer and learned multitasking is the enemy of full engagement. Now, watch this clip. This is 4 big NFL football players who were going through this health athlete course in Florida. They were given a task, a mission. We want you to run through the Florida woods for a half a mile, touch the white fence that you're going to see, and run back. The 4 football players looked at the psychologist and laughed. They said, "That's nothing. Do you know what we do to train to be an NFL athlete, football player?" And the psychologist said, "Oh, wait a minute. I forgot to tell you. There might be wild boars on your journey to touch the white fence. Look what happens when these guys get ready to touch the white fence and the psychologist plays a wild boar hog sound." They were not fully engaged. They were looking around, they were kibitzing, but that's what happens when we're not fully engaged. When clinicians are not fully engaged, they make medical errors. So teaching people about staying in full engagement is really important. And the other thing, to have great energy, we have to be aligned with our dreams, our purpose, our passion. If you're aligned with your dreams and your purpose, your passion, you're going to experience such joy. You're going to go to work every day with joy because you're aligned. So in this course, we teach everybody, face your true story, write your new one, and then align with it for more energy. So 4 years ago, I started a new wellness onboarding program for our health sciences students across all 7 health sciences colleges. So within 2 weeks of starting medical school, NP school, dentistry, vet med, students complete a personal wellness assessment. They do a biometric screen, and then they get hooked with a nurse practitioner student who serves as a health coach for the other students for a whole semester. And we study those students over time. This past year, the students delivered that CBT program that I talked to you about. We got great outcomes, but listen to this. 30 to 40% of incoming students to our university meet the cutoff for depression. 30 to 40%, more than anxiety. So if we don't screen them on the way in, we found 11 suicidal students in the first 110 we screened this past year. So if we don't screen, we're not going to find. So we've seen so many great population health outcomes here because of what we're doing with wellness. We have seen drops in depression and anxiety, although this past year, stress bumped up, which didn't surprise us because there's a lot of leadership changes and things happening in the medical center. And what I need to hear from you nurses that are here today, if you have ideas for what we can do more to help you with stress in particular, please reach out to me and let me know about that. We've had a 7% improvement in cardiac outcomes. And last year, we saved this university over $15 million as a result of what we've done with building a wellness culture. And I'm happy to say that's why premiums didn't increase this past year, because we're getting such great outcomes. So I pulled the 7 health sciences colleges together. September 26th to 28th, we're having a big national summit here in Columbus on clinician well-being. And we invented a national award, and I wrote to Victor Zhao, the president of the National Academy of Medicine, and said, we've chosen you with our national award this year, so he's coming to the reception, which is great. So I hope you'll join us. We are also the founders of this new national organization on building healthy academic communities. And this April and May, we'll be hosting our 4th BHAC Summit here at Ohio State. So here's my family. I have 3 beautiful girls. Kaylin in the upper left-hand side of the screen with her 1 of 5 dogs, Mia. She just got white-coated last week. She finished her 3rd year of vet school, so she'll graduate next May. These are my other girls and my 2 little grandbaby boys. And then my little pug puppies up there, which create some character builders in my life on a pretty regular basis. And there's my husband, who puts up with my crazy schedule and supports me. But when I don't feel like getting up and exercising, I put those faces in front of me. And I say, if I'm not going to do it for myself, I'm going to do it for them, because they want me around for a while. And I want to be around to see my grandboys grow up. So what are you going to do to help us in the next 2, 3, 5 years? How can we build the best wellness culture here? And lastly, I'm going to end with this little girl who's going to motivate you more than I can.
Do it! Just do it! Don't let your dreams be dreams. Yesterday you said tomorrow. So just
It's lagging.
make your dreams come true. Just do it. Some people dream of success. And you're going to wake up and we're going to work hard at it. Nothing is impossible. You should get to a point where anyone else will quit. And you're not going to stop there. No, what are you waiting for? Just do it. Just do it. Yes, you can. Just do it.
I love that. And then she swipes her mouth and walks away. So if you do not tweet, follow me on Twitter at Bernadette Melnyk for daily doses of wellness inspiration. And last of all, again, thank you for all that you do. Happy Nurses Week.